Many ways I would describe our approach to the residency program as, the residents are in a contact sport. There's no sitting on the sideline observing. You're actually in it.
The physicians and other members of the care team really look at us as the medication experts. So we make sure that our residents really take that on.
The science has changed. The number of drugs we have to understand has grown very quickly. But the thing that really counts is us taking care of patients and taking care of one another. That has never changed.
During my interview, really loved the people here. I thought that they were all very friendly, and this was definitely an environment that I could see myself learning and growing and getting to know my preceptors in.
The main reason I stayed at Tufts was because I did so much time here as a pharmacy student. I interacted a lot during that final year of my pharmacy school and realized these residents are challenged, but they enjoy the process and become better by the end of the year.
The people you surround yourself with make up the majority of your life, especially for residency when you're picking up and moving to a new city. It's really important who you work with. And that was very evident on interview day that they feel the same way.
There's a saying that, I don't know where it comes from, but it's something along the lines of, all of us are smarter than any of us. And I think that's part of how people think here. And I think that perspective, that viewpoint, that way that people practice here is what creates the sort of culture we're talking about.
After interviewing at 11 different places, Tufts Medical Center really stood out to me, meeting the people here with all the different experiences that I was looking for within a program, but working side by side with all these people every day was really what sold it for me.
I think with Tufts, you get a wide array of patient experiences. The population of patients that we serve, from adult to pediatric, to some very complex populations in hematology, oncology, heart transplant. I think those experiences and that depth of experience that you can get in the full year is unique to Tufts.
I'm learning a lot of different disease states that I haven't experienced before, like sickle cell disease or pulmonary hypertension, lots of heart transplants here, so I'm pushing my boundaries clinically.
When we have a really complex patient and we're trying to manage them in the ID clinic, I'm also talking to pharmacists in the nephrology clinic, the transplant clinic, the cardiology clinic. So I think that's one of the cool things here is just how many different specialties and so many different areas that our residents get exposure to.
It was only when I actually started here and became a resident here that I really saw during every rotation, every team that I worked with, they were always very reliant on pharmacy.
You become, independent on rounds. You still have a shoulder to lean on with your preceptor where you can ask questions, but you feel like you're actually the pharmacist. And I felt like in the short, few months that I've been here, I've already grown a lot.
I think you'll have a great balance between being challenged by your preceptors, by the clinical environment. The culture between the medical staff and the pharmacy is great. They love our input and are very much willing to learn from us as well.
I've gone through all my internships where you're just kind of a student, but now they really let you hit the ground running, really kind of try out your skills and really kind of just be a pharmacist, with some oversight, obviously.
The physicians and nurses, everybody looks to us for help sometimes. It's very collaborative. The residents and interns all know who we are, ask us for help when they're looking for it.
So on our clinical rounds, we're a huge part of the team, making decisions hand in hand with nurses and physicians. But also that happens in scheduled meetings with our physicians and different committees.
You have other physicians and nurses who respect the information that you're going to give to the patient and to the team. And kind of putting that all together so that you feel part of a family, I think, is what makes us unique. And just that you have a lot of support from all aspects of the pharmacy department.
It's the best. I love Boston. I always wanted to come here. Always something to do. really great food, really great drinks, and it's just like anything after work is easy to walk to. You're by the water. You can 1 hour up to New Hampshire, out to the Cape.
Boston's a great city. It's very walkable, which is nice. And the public transit is really good for the most part. You can get to pretty much anywhere that you want to go.
I love how there's always something to discover in the city. I'm not doing something twice. I'm always trying new restaurants, trying new places. You can kayak right in the Charles River, which is at the heart of the city.
I love it here. So I guess that's the only point. Yeah, I truly do. It really is something special.